how do you see technology changing the way that care is delivered?
So I think, digital health, which is the space that I kind of operate in, is this really big field, and there's so much going on in digital health. But as it relates to the senior population, so kind of at the intersection of the senior population and digital health, I think there's a few themes that I think are worth exploring. The first is care anywhere. So, telepresence is something that's existed for a really long time. I mean, I think we've been doing, video chat for now probably like 10, 20 years. But it really hasn't broken into healthcare, I think, in a mainstream way just yet. I mean, we're seeing some of it, but it's a new way of interacting with your providers. At CareMore this year, we're offering all of our members the opportunity to use a product called Live Health Online that allows them to see a doctor 24/7, 365 via their tablet, their smartphone, or their computer. So, that's just one way that we're allowing people to interact with the healthcare system in a different way. It's also allowing caregivers to be able to have support. So, caregivers historically, if you wanted to get support, you have to call someone up, or you'd have to go into a primary care, a brick and mortar facility. Now you have the ability to bring in, a doctor or a nurse into the home to interact with them. Behavioral health is a big issue. And for some folks, leaving the house is really difficult. Now you can bring therapy to the home. And, we take it for granted because we all have it on our phones and our tablets, but it really hasn't really broken into the mainstream yet in healthcare. I think the other area that we're seeing is this paradigm shift in caregivers. Traditionally, caregiving has been a doctor and a patient. And then we started seeing a nurse practitioner and a patient, or maybe a PA and a patient. And when you really look at folks with multiple chronic conditions, folks in the Medicare population, sometimes health doesn't necessarily mean medical stuff. And we've heard this come up a few times. Sometimes health means making sure that they have food in the fridge. Sometimes health means making sure that they know how to take their medications and that they have someone to go and get their prescription refilled. Sometimes health means making sure that there's not hazards in the home where people are going to fall. So there's all these different socioeconomic, social determinants of care, ADLs that we're seeing, and care doesn't necessarily need to be something that someone with 8 years of education has to deliver. So we're seeing this paradigm shift. We're seeing things like Honor that you guys heard about earlier. We're seeing Heal that's in the back, where you can go and have a doctor show up at your door and have a primary care doctor that comes to you as opposed to you going to the primary care doctor. So I think those are two big themes that I'm seeing.
Right, so I looked. You have a great blog. You should check out his blog. And one of the things you talked about was telemedicine,
yep,
which I think you're mentioning here, and its benefits. I'm 66 years old, and I've been used to going to a doctor for my whole life who I see face to face. And I worry that if I do something by telemedicine, or if I follow up by telemedicine, that my doctor's not really going to be able to sort of see me and 3D and virtual, whatever, real reality, and,
right,
and sort of know how my color is or whatever to see if I'm okay. So that's a worry that I would have. Can you?
Yeah, that's a good question. I mean, I think everyone here at some point has interacted with the healthcare system. So just think in your mind, I mean, how often have you gone to your doctor's office for a follow-up visit? Mm-hmm. Okay, you go to the follow-up visit, you wait in the waiting room. If you're lucky, it's less than 30 minutes. Mm-hmm. Then you go see your doctor. First, the nurse takes you to the room. They ask you a bunch of questions. Then your doctor comes in, like for 5 minutes, asks you 3 questions, and then they leave. That's easy for me to do. But for someone that is maybe elderly, that has a difficult time, ambulating, that's an entire day. Mm-hmm. And so we're not necessarily saying that you need to replace, or I'm not saying that you need to replace healthcare with technology, but I think there's certain times where technology can play a really great role. So telepresence would be great for that. People that are depressed, I think for behavioral health, there's huge telepresence opportunities. These are folks that if you're really depressed, it's really difficult for you to get out of the house. And that might be a barrier to you going and seeing a clinician.
It makes sense.
That
I mean,
can
it
be
makes
the first
sense.
step.
I remember a few years ago at the CES show, I saw a video game. It was a video game that was solitaire. And it was programmed so that for a person who was home by themselves, that they would play the game. They would monitor how they moved the cursor and how they played the cards. And it was able to detect a slight change in being able to move in a straight line. And they would be able to detect things like strokes or other kinds of difficulties just by getting feedback from the game. So I'm a believer in that stuff. So where's the greatest need, since I know that one of your passions is sort of, taking care of the needs of very large populations. So where do you find the greatest need and opportunity for digital health?
So this is a statistic that I don't think I've ever given a talk without quoting the statistic. 5% of the healthcare population is responsible for 45% of the expenditures. And the people at in that 5% bracket are folks that have multiple chronic conditions. And when you don't manage multiple chronic conditions effectively, that leads to overutilization, it leads to ER visits. And when you look at the Medicare population, 44% of the population has 3 or more chronic conditions. When you look at the dual eligible population, 55% of that population has 3 or more chronic conditions. I think there's tremendous opportunity for us really to use technology to innovate and to address the needs of folks that are kind of in that 5% bracket.
So why aren't we seeing greater innovation in these areas now?
This is, I think, this is why I'm so excited to be sitting here and why I'm so happy that this conference exists. I think first and foremost, it's not sexy. Medication adherence isn't sexy. And when you're, a 20-something hotshot coming out of Stanford, you can go work at Snapchat that's about to IPO, or you can work on medication adherence. I think that's kind of the first issue that we have is kind of, even though the opportunity in healthcare is tremendous. I think the second thing is that, health plans and large health systems aren't always the easiest companies to work with. And I'm willing to say that. Like, we're trying to do something about that, make it easy for people to work with companies like CareMore. But these are large organizations. They're somewhat bureaucratic at times. And more than anything, health plans especially oftentimes are risk averse. I mean, their job is to manage risk. And so they're very data driven, and they want to see outcomes data. They want to see research. And oftentimes when you have a new technology, you don't have you haven't studied it for 3 years, and you haven't invested the money to do the analysis for 3 years. You don't have like the clear ROI analysis. So I think that's often an issue. And another thing is, oftentimes I'm seeing increasingly that there's sometimes a disconnect between digital health companies and digital health startups and the issues and the needs that exist within not only the healthcare marketplace, but also the structure of how to sell into and how to work within a health system, why I thought the lunchtime activity was brilliant. Because here you have people in the health industry kind of informing startups or new companies how they can be of service to this, not only to this community, but also how to play well in that space. And the other thing is, most technology is designed for 40-year-olds. 40-year-olds are the #1 purchasers of consumer technology. I think our average age patient is something like 71, 72 years old. Those demographics are very different. Generationally, they're different. The way they interact with technology, they're different. They have different constraints. So I think all of these kind of combine to make it a little bit more difficult for people to come in and really focus on that 5% that's driving 45% of the expenditures.
So earlier today, I saw something I'd never actually seen before, but it was a list from the FDA of different kinds of apps and different kinds of games and different kinds of technology that it sort of had on a list of things that they were watching to see if they were going to start actually requiring them to get FDA approval. And it was interesting, okay? Like very, very broad, very broad. Do you have any fears that the FDA, I mean, right now you can sort of come up with something and you can go to market with it pretty quickly. You don't have to get FDA approval. You don't have to go through clinical trials and 8 years worth of time and millions of dollars worth of money to bring something to market. Do you have any fear of it, or have you heard anybody who's sort of worried about something that this might happen?
That's a tough question. So I think in general, I think from what I've been seeing, the FDA sees the digital health space and the rise of apps. And to some extent, I think they're trying to be flexible, but at the same time, I think they have a mission and a charge. I mean, we saw with 23andMe, I was an early user of 23andMe, and they gave me all this information, and one day, all of a sudden, it was gone. Because it was kind of, they were looking at it as diagnostic information, they were looking at it as like treatment advice, if you will. So I think a lot of companies tiptoe that line, and I think a lot of them get creative about how they go around that. But I think that issue is always going to exist.
Okay.
Yeah. So I mean, we got a chance to kind of talk a little bit beforehand, and you have a very interesting point of view. You're an attorney, you're a businessman, you've done work in the senior living space, you teach at that other school in the gerontology.
USC has fewer letters in it. That makes it a more valuable domain.
There's a very easy joke that I can do there, but I'm not going to say it. So you had a very interesting way of kind of differentiating between wellness and health. And sometimes when we talk about digital health, we don't really differentiate or bifurcate digital health into wellness and health. So how do you define wellness?
So I mean, we could go on for hours about how you define wellness, and there are many different definitions that people have, and whether you include, when you include areas of psychology like positive psychology, or whether you believe in sort of the kinds of theories like flow. You know, I go with a very simple definition, which is based on self-determination theory, and it just says that wellness is a feeling of competency, autonomy, and relatedness, and that if you have those three things, that you're happy, which I sort of equate in many ways with wellness.
And how
so that's how I define it. How
do you see wellness? How do you see technology having an impact on wellness as folks get older?
Well. First of all, I mean, I'll just bring up two different areas. One is everybody has, or most people have, a smartphone now. Smartphones are amazing as you grow older. I mean, they remember things for you, they remember appointments for you, they make calculations. You have all this information right at the tip of your hands. You have every app and anything you could ever want right there. Okay, so technology is already making growing older easier, right? You also have things like games, which is one, I taught a course in games last year, and games are sort of interesting because what they actually deal with are competency, autonomy, and relatedness. So if you are, and I think the games are being used more and more and more and more. And if you use games, and if you play video games or even play board games, it can actually transfer. It can actually help you become less of what most older adults, or a lot of older adults, suffer from, which is isolation, right? Or a feeling that they're sort of not in control of their own world, or they're feeling that they're sort of behind the times, that they don't know things, which is competency, autonomy, and relatedness.
Awesome.
Yeah.
Awesome.
So in the time left, we wanted to have some fun, because both of us are sort of, I guess,
we're geeks.
Yeah, we're geeks, and so we look at technology and future technology, since that's what this is about. So we're both going to sort of, go one by one and just tell you about technology that we see coming in the future that we just think is really exciting.
Yeah, awesome. So a lot of you probably have like an activity tracker, an Apple Watch, or something like that, and you probably are noticing that we're in a little bit of a sensor lull. What I mean by that is, we have heart rate sensors. We can do that pretty well. We have 3-axis accelerometers, so it can look at your steps. But we haven't really seen in a while some really game-changing sensor technology that you can wear on your wrists or wear very comfortably. So I think we're about 1 to 2 years out from really game-changing technology. One of the things I think is going to be very interesting is continuous glucose monitoring using interstitial fluid. So interstitial fluid is the fluid that's right below your skin.
Wow.
And so there's a company by the name of OnDuo, which is a joint venture between Verily, which is Google Health, and Sanofi Aventis that has about $500 million worth of funding. And they're developing a sensor that's about the size of a $50 that you wear as a patch. You don't even feel it. I've actually felt the needles. You barely feel the prick when you put it on. And it's continuously monitoring your blood glucose. It's communicating with your smartphone, telling you, giving you real-time feedback about foods you're eating, et cetera. So that's really exciting. When I was at CES, I saw another company called K-Track that has a watch that has that same sensor kind of built in. All this stuff is pre-FDA. But I mean, imagine if your Apple Watch tells you that what you ate, you shouldn't have eaten something because you had a huge glucose spike or whatever it may be.
Honestly, right now my wife does that.
Yeah, right.
So I know we have 1 minute left, but the technology that I see the most promise in is virtual reality, and it's fraught with all kinds of problems and dangers and things like that. But I think they'll work through that. I think that through testing and through research, they'll work through a lot of those kinds of things. But I see it especially good for older adults. I mean, at first glance, I said, we'll be more susceptible to dizziness and things like that because we don't process as fast. And then I thought about it, and its uses in things like simulations, like driving simulations that can help prevent, automobile accidents, or its use in being able to help someone focus without any distraction on something. Because in virtual reality, you can remove all the distractions, so selective attention, doesn't affect you in that environment. Things that have to do with context, something that, let's say, you want to cook, or you want to play a game, or you want to do something that requires you to learn a little skill before it. You can learn it in a virtual reality environment, and I think that one of the probably, I haven't read anything that anybody said this though. At Elder Gadget, where I worked for about 5 years, it was a company I started, we used to look at interfaces a lot. And I thought interfaces were the thing because that's sort of what hinders people from using technology. And with older adults, especially, they don't want to learn them. They don't want to learn new technologies. I love games. But I don't play video games because I can't use the controller. It's too hard. I don't want to spend the time, and I got to use and I'm not like my kids who can do that in a minute. In virtual reality, you are the controller. Your hands do things, your feet do things, you look places and do it. We're all experts at that as we grow older. So this is the perfect interface for us if they can get it right and make it safe for people. Thank you very much.
Awesome. We're out of time.
Thanks. Good.